going to be your nurse today. Can you tell me your first and last name?
Mary Moran.
Miss Moran, can I see your wristband?
Yes.
When's your date of birth?
January 8th, 1998.
All right. Today we're going to be performing a head-to-toe assessment on you that does involve some touching. Is that all right with you?
Yes.
Okay, perfect. Is there anything I can do to make you feel more comfortable before we begin?
No.
Do you have to use the restroom?
No, thank you.
Okay, I'm assessing the patient's demeanor. She looks appropriately dressed. She's awake, alert, oriented ×3. Examining your skin. By general appearance, I can see that the color is appropriate for ethnicity. It's nice and pink, dry, warm to touch. There's no obvious lesions or lumps, marks, cuts, scrapes. The turgor of your skin is elastic. There's no obvious tenting. Taking a look at your hands, I can see that the nail beds are pink. There's no obvious clubbing. The capillary refill is brisk. Examining, first I'm looking to see the hair color and quality. We have blonde, very thick, no alopecia noted. The scalp is intact. There's no dandruff, no deformities, no masses, no tenderness. Continuing down to the examination of your face, I'm going to be examining cranial nerve number 7. Go ahead and smile for me. Perfect. Frown. Can you puff your cheeks? Perfect. Cranial nerve number 7 is intact. Moving on to cranial nerve number 5, trigeminal. Please clench your jaw. Good. Any pain?
No.
Can you wiggle your jaw left to right, up and down? Any tenderness?
No.
Okay, I'm going to go ahead and palpate. Let me know if you feel any discomfort.
No discomfort.
Okay, perfect. Continuing with the trigeminal examination, I'm going to show you what a sharp and a dull sensation feels like. This is dull.
Okay.
This is sharp. Go ahead and close your eyes. Let me know what you feel, okay?
Sharp. Dull. Sharp.
Go ahead and take a look at the eyebrows and eyelashes. We see that there's equal distribution. There's no abnormalities noted. On the eyelids, they're appropriate for age, no lesions. Go ahead and pull your eyelids down for me. We're going to be taking a look at the conjunctiva and the sclera of your eyes. I see that it is pink and moist with appropriate vasculature, and the sclera is white. Okay, now I'm going to examine your cornea. I'm going to be shining a light in your eyes, just a warning, okay?
Okay.
All right, go ahead and look straight forward. I see no cloudiness, no ulcerations. Perfect. Your iris is blue. Your pupils are 3 and brisk. Great. Pupils are equal, round, reactive to light, and accommodation. Next, I'm going to have you follow my pen light. Keep your head still. Testing out cranial nerves 3, 4, and 6. As well as convergence. Now checking out the eye alignment. Go ahead and look at my pen light. Go ahead, look straight ahead. Perfect. Back at my pen light. Straight ahead. Pen light. Straight ahead. Perfect. Now we're going to do a visual field examination. Go ahead and let me know when you see my fingers come into view when wiggling. Okay.
Now. 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 Now.
Examining your ears, I'm going to take a look and make sure that they are symmetrical, looking for any obstruction, drainage, and serum. Not that I see any. Now we're going to be performing a tug test. I'm going to be pulling on the auricles. Let me know if you have any pain.
No.
Any tenderness?
No.
Now we're pressing on the tragus and the mastoid. No reported pain or tenderness. We're going to perform a whisper test. I'm going to have you place this hand over this ear. I'm going to whisper a word and you let me know when and if you hear it.
I hear.
Cranial nerve number 8 is intact. Now we're going to be moving forward with the nose. From visual appearance, it is symmetrical. Going to take a closer look, examining that the airway is patent. We're going to make sure that there's no obstructions. I see that the mucous membrane is pink. There's no polyps. The septum is not deviated. We're going to now examine the sense of smell. Closing your eyes, I'm going to have you determine what fragrance you smell.
Coffee.
Great. Mouth, I'm going to visualize that the lips are pink and moist with no obvious cracking. Go ahead and open your mouth for me. Inside the mouth, I'm seeing that the teeth are white, intact. There are no crowns or cavities. Go ahead and stick your tongue out. The tongue appears rough, pink, and moist. Say ah. Perfect. The tonsils do not appear red. The uvula is midline, smooth and soft. There's no apparent ulcers or lesions. There's the appropriate amount of saliva. Go ahead and stick your tongue out. Can you put it up, down, left, and right? Repeat after me. Light, tight, dynamite.
Light, tight, dynamite.
Cranial nerve hypoglossal is intact. Now we're examining the neck. It's symmetrical. Trachea is midline. Swallow for me. Perfect. Lymph nodes. I'm going to put a little pressure in various spots. Okay, so go ahead and hold still for me. We're going to be doing the pre-auricular, post-auricular, occipital, posterior cervical, anterior superficial cervical, tonsillar, submandibular, superior clavicular, infraclavicular. All right, any tenderness?
No.
All right, no tenderness noted. Now we're going to be continuing with the chest examination. Upon inspection, we see no lesions or scars. We're going to go ahead and examine the respiratory rate and effort. She's even and unlabored. There's no accessory muscle use. Continuing on, we're going to then palpate. Please let me know if there's any tenderness or discomfort.
Okay.
We're going to go ahead and apply pressure here, making sure that there's no tenderness, no crepitus. We're going to palpate the carotid arteries one at a time. And then we're also going to check the brachial and radial arteries, +2 bilaterally. Continuing on, we're now going to percuss. I'm going to have you lean forward and I'm going to apply a little pressure to your back. Here to the side. Okay, so applying pressure. At this time, I'm going to mention the healthy resonant note I'm hearing of the percussion over the lung tissue. No tenderness noted. We're going to continue on by listening to your breath sounds. Every time you feel my stethoscope placed on your back, go ahead and take a deep breath. Loud, high-pitched bronchial breath sounds are heard over the tracheal area. Medium-pitched bronchiovesicular sounds are heard over the mainstream bronchi between the scapula and below the clavicles. Soft, breezy, low-pitched vesicular breath sounds are heard over the peripheral lung fields. So the breath sounds are clear bilaterally, no adventitious sounds noted. Continuing on, we're going to go ahead and listen for any bruits with the bell of the stethoscope on your carotid. Go ahead and take a deep breath and hold. Great, go ahead and breathe. We're going to do the same thing to the other side. Go ahead and take a deep breath and hold. No bruits noted. Continuing on, we're to your heart. We're going to start with the aortic. S1 and S2 noted. Pulmonic. S1 and S2 noted. Herbs. S1 and S2 noted. Tricuspid. And mitral. Now we're going to use the bell of the stethoscope and do the same thing. Aortic, pulmonic, herbs, tricuspid, mitral. S1 and S2 noted, no gallops, no murmurs, no pericardial friction. The abdominal portion of this section, I'm going to start with inspection. The abdomen looks soft and flat. The umbilicus is midline. There are no lesions or obvious scars, no masses or pulsations visible. I'm going to continue with auscultation, starting in the right lower quadrant, making sure that all bowel sounds are present and active. Moving up to the right upper quadrant, left upper quadrant, and left lower quadrant. Bowel sounds are normal, active, present in all 4 quadrants. We're now going to continue with percussion, listening for tympany and dullness. I'd like to note the tympanic sound on percussion, typically indicating a gas-filled abdomen. Any tenderness, I'm going to go ahead and start palpating. Please let me know if you need to use the restroom or you feel uncomfortable. I'm going to start with light palpation. No masses. No crepitus. No lesions, no pulsations. Now we're going to go ahead to deep palpation, a little more pressure. Let me know. Any pain. Pressing 1.5 to 2 inches into the abdomen. I'm feeling for any palpable organs. All right, very nice. Next, going to be examining the extremities. Do you mind showing me your arms and legs? Okay, so the hair distribution is even on the upper extremities. This patient does shave her legs, so that will be noted in our report. We're going to now check for edema. There's no pitting edema in the lower extremities. We're going to be examining several different pulses, starting with the femoral. All right, so +2. We're going to do the popliteal bilaterally. We're going to do the dorsus pedal. Posterior tibial. Okay, all pulses are present and +2. Now we're going to be doing the range of motion of the extremity. So I'm going to have you stand up and follow after me. Okay. First, we're going to chest out the range of hip. Follow my lead. This is flexion. Then you have extension, adduction, across, and abduction. Very good. For your knees, if you could just lightly squat. When you squat down, that's flexion. When you come back up, that's extension. For dorsiflexion, it's going to be of the ankle. You're going to point, and then plantar flexion. Very good. For the toe, flexion. Flexion is pointing down, extension is pointing up. Perfect. Now we're going to do flexion of the shoulders, up, extension back, adduction, midline, abduction, apart, flexion of the elbows, extension, supination, and then pronation. Then you have the wrists, flexion, extension, fingers, we have flexion and extension, adduction, ADD together, and extension, extend. The patient has full range of motion and displays appropriate muscle strength. Now for the neurological portion of the exam, we're going to demonstrate the soft and sharp sensation again. So recurring, you're going to feel soft and sharp. Go ahead and close your eyes and let me know what you feel.
Soft. Sharp. Soft. Sharp. Soft. Sharp.
All right, very good. Now we're going to be doing the sternosis. I'm going to have you put your hand out for me. I want you to identify the object that's in your hand. Okay, close your eyes. Tell me what it is.
Paperclip.
Very good. Now here, anesthesia, let me know what letter I indicate on your hand with your eyes closed.
An O.
Perfect. We're going to be examining the deep tendon reflex, starting with the triceps. We're going to go ahead and tricep. We're going to now do the bicep and the radial. Very good. Now working our way down to the lower extremities, the knee and the ankle. Very good. Deep tendon reflexes are present. Now we're going to perform a heel to toe walk. I'm going to have you stand up and walk from heel to toe. Take a couple steps. Very steady gait. No difficulty. Go ahead and come back. Now we're going to perform a Romberg test, which is I'm going to have you turn and close your eyes. We're going to see if you get dizzy, making sure you're steady on your feet. Very good. We passed that. Now the next thing I'm going to have you do is bend down and touch your toes. We're going to examine your spine. Spinal cord is straight. No abnormalities. Very good. Thank you, Ms. Moran. Go ahead and have a seat. And this concludes my head to toe assessment. Thank you for your participation and thank you for your time.